The honourable member for Brampton West.
Thank you, Mr. Speaker. Mr. Speaker, I'm very pleased to rise in the House today to speak in support of Bill C37, an act to amend the Controlled Drugs and Substances Act and to make related amendments to other acts. Mr. Speaker, as you're aware, Canada is facing an opioids overdose crisis across this country. We have seen very troubling figures and have heard many tragic stories. As stated earlier in the House, British Columbia alone saw 916 illicit drug overdose deaths in 2016, an almost 80% increase from the year before. And majority of these overdoses are due to opioids. Other parts of the country have also been impacted as well, with Alberta reporting 343 apparent overdoses related to fentanyl in 2016, and over 30% increase from the year before. While some areas have been more acutely affected than others, drug use is not unique to one part of the country, and the potential for this crisis to spread is very real. Mr. Speaker, our government is committed to addressing this complex public health issue through a comprehensive, collaborative, compassionate, and evidence-based approach to drug policy in Canada. To that end, Mr. Speaker, the Minister of Health, with support from the Minister of Public Safety and the Minister of Justice, announced that the new Canadian Drugs and Substances Strategy on December 12th of last year. This new strategy replaces the previous national anti-drug strategy with a more balanced approach by restoring harm reduction as a core pillar alongside prevention, treatment, and enforcement, and supporting these pillars with a strong evidence base. The Canadian Drugs and Substances Strategy formalizes our government's commitment to taking an evidence-based and more appropriate health-focused approach to addressing problematic substance use in our country. Mr. Speaker, the bill proposed ensures a sound and modernized legislative base to support this new strategy. This comprehensive bill aims to balance protecting public health and maintaining public safety. It is designed to better equip both health professionals and law enforcement with the tools they need to address this issue. Specifically, Mr. Speaker, this bill would improve the government's ability to support the establishment of supervised consumption sites as a key harm reduction measure in communities. It would address the illegal supply, production, and distribution of drugs and reduce the risk of controlled substances used for legitimate purposes being diverted to the illegal market by improving compliance and enforcement tools. Mr. Speaker, in addition to introducing this new strategy, proposing this bill, and building on our 5-point action plan, our government has taken and continues to take concrete steps to address problematic substance use. Since coming into office, Mr. Speaker, our government has used all the tools available to address this issue. One of the first steps our government took, as expressed by experts, was called for increased availability of naloxone, a drug that temporarily reverses an opioid overdose. We acted quickly in this regard to move the requirement to have a prescription to facilitate access to naloxone in March 2016. Further, Mr. Speaker, our government completed an expedited review of an easier-to-use nasal spray version of naloxone, which, as of October 2016, is now approved for sale in Canada. In the meantime, Mr. Speaker, our Minister of Health used the extraordinary legal authorities available to her under the Food and Drugs Act to issue an interim order to allow the emergency import of naloxone nasal spray from the United States. This significant step has increased access for emergency responders and helped to address a growing number of opioid overdoses. We have also demonstrated our support for the establishment of supervised consumption sites, a key harm reduction measure. Through a thorough and rigorous review, in January of 2016, Health Canada granted an exemption from the Controlled Drugs and Substances Act for the Dr. Peters Centre to operate as a supervised consumption site. Not long after that, in March 2016, Health Canada granted Insight an unprecedented 4-year exemption to continue its extremely important work in downtown Eastside neighbourhood of Vancouver. Insight has demonstrated time and again through countless number of peer-reviewed research studies that it saves lives without increasing drug use and crime in the surrounding area. This 4-year exemption is a positive shift from the previous annual exemptions. And just last week, Mr. Speaker, Health Canada issues 3 new exemptions for supervised consumption sites in the City of Montreal, for the first such exemptions outside of the province of British Columbia. Mr. Speaker, I do want to briefly touch upon a concern that is raised in this House by the opposition, that the views of community would no longer be important in the assessment of an application to establish a supervised consumption sites. Let me be very clear, Mr. Speaker. This was actually determined by the Supreme Court of Canada. The Supreme Court of Canada determined that the Minister of Health must consider expressions of community support or opposition when reviewing such application. Our government is respecting the Supreme Court of Canada's decision by proposing to include these factors in this legislation. We support the need for community consultation in the application process for considering the establishment of supervised consumption sites. We understand and respect that communities may have valid concerns about a proposed site and that these concerns deserve to be heard and should be adequately addressed by applicants in their applications. The proposed amendments would demonstrate that the respect for communities is a multifaceted issue. It means that the concerns of community must be considered and addressed by the applicants. However, it also means that the federal government should not place any unnecessary barriers in the way of communities that need and want to establish the supervised consumption sites as part of their local drug harm reduction strategy. In order to combat this crisis head-on, Mr. Speaker, our government is also supporting Private Member's Bill, Bill C-224, the Good Samaritan Drug Overdose Act, a bill that would help encourage individuals who witnessed an overdose to call for emergency help. It would provide immunity from minor drug possession charges for individuals who experience or witness an overdose and call for emergency assistance. Mr. Speaker, the opioid crisis is something we know we can't fix alone. We need a collaboration with all levels of governments, experts, and professionals. This is why we're committed to working with our colleagues across Canada to address opioid crisis, from medical professionals to law enforcement partners. In November last year, Mr. Speaker, the Minister of Health co-hosted an opioid summit and conference along with the Ontario Minister of Health. The summit and conference brought together governments, experts, key stakeholders to address the opioid crisis and to determine a path forward. Participants heard a number of perspectives on this crisis, from people who use drugs, from families devastated by opioid misuse, healthcare providers, first responders, educators, and researchers. Mr. Speaker, provincial ministers and heads of organizations with the ability to bring about change committed to a joint statement of action to address the opioid crisis. This joint statement of action reflects a combined commitment for each participant to work within their respective areas of responsibility to improve prevention, treatment, and harm reduction associated with problematic opioid use by delivering on concrete actions. And, Mr. Speaker, we will publicly report on the progress of these actions starting in March of 2017. In conclusion, Mr. Speaker, Bill C-37 is a key example of our government's commitment to establishing a comprehensive, collaborative, compassionate, and evidence-based approach to drug policy in order to reduce the harms currently being experienced by individuals and communities caused by drugs. Mr. Speaker, in the end, I just want to say that one life lost to an opioid overdose is one too many. We need to take action now, and as this bill will help save lives. And that's why I strongly encourage all the members in this House to support this very important piece of legislation. Thank you, Mr. Speaker.
Questions and comments? The honourable member for South Surrey White Rock.
Thank you very much, Mr. Speaker, and I want to thank my colleague here for her speech, and as she just said, one life lost is too many. I go back to the Delta mother who lost both her children within 20 minutes of each other, both of them in their 20s. I have a list here of over a dozen kids, 21, 23, 24, mid-20s, and that's just a snapshot. And I'm wondering, and these kids were not injecting, they weren't using consumption sites. So I'd like to ask the member what the government is doing in this regard, because one life lost is one too many.
Yeah. Honourable Parliamentary Secretary to the Minister of Revenue.
Thank you, Mr. Speaker. I want to thank my honourable colleague for her question, and my condolences go out to the family that she just mentioned. And, Mr. Speaker, we know we need to have a comprehensive approach in order to face this crisis. Harm reduction alone will not solve the opioid crisis. It requires a range of approaches, which also includes treatment. And we know that there's a tragic shortage of treatment facilities in this country. As my previous role as Parliamentary Secretary to the Minister of Health, I heard loud and clear that there's a significant gap in getting access to treatment, especially when it comes to mental health and addictions. And that is why our government were able to offer the provinces and territories $5 billion of new money for mental health and addictions in the health accord. And we certainly hope that provinces, especially where there's a greatest challenge, Mr. Speaker, will use some of these resources to expand access to treatment facilities so that people will get the treatment that they need. Thank you, Mr. Speaker.
Questions and comments. The honourable member for Vancouver East.
Much, Mr. Speaker, and I thank the member for her comments as well. I've been listening to this debate with interest, of course, and often the downtown east side, the community in which I represent, is referenced. In fact, the member from Lethbridge talked about the Insight situation where people in and around a community are continuing to overdosing, as though somehow that's evidence to show that Insight is not working, as somehow that's evidence to show that harm reduction is not working. The fact of the matter is, if the member actually looked into this situation, she will realize that Insight is not a 24 hours a day, 7 days a week service, nor it also has reached its capacity. So it goes to say that why this bill needs to be passed so that we can get on with ensuring that supervised injection facilities are happening in communities where there is a demonstrated need, as per the Supreme Court decision had clearly outlined. I also want to say, and I will extend this invitation to the member opposite, and in fact all members of this House, that where anybody wants to speak to a witness, I would welcome them, and I would in fact personally ensure that they could sit down to meet with Dr. Patricia Daly, who is the health officer for the City of Vancouver, as well as Dr. Perry Kendall, who is the health officer for the province of British Columbia, to talk about this issue. And so I would like to extend this offer to all members of the House, including the member from Lethbridge. To the member who just spoke on this issue around supports, people are burning out in our community.
So order. Fortunately, we've run out of time. Just to give the Honourable Parliamentary Secretary an opportunity to respond, the Honourable Parliamentary Secretary to the Minister of Revenue.
Thank you, Mr. Speaker, and certainly want to thank the honourable member for her question, her comments, and I've seen the member in the Health Committee when I was sitting previously, and the amazing work that you do for your community is really commendable. So thank you for that. And, you know, Mr. Speaker, as I've said many times in this House, our government's policies are driven by science and evidence clearly shows that when properly established and maintained, supervised consumption sites can save lives and improve health without negatively impacting the surrounding communities. They provide hygienic facilities, sterile equipment, and are supervised by qualified staff members who can provide advice on harm reduction and treatment options, as well as prevent an overdose. And Mr. Speaker, many times, this is the first time that an individual's come in contact with a healthcare professional because of these sites. So thank you again. I just want to thank the honourable member for her question once again.
Resuming